Should it be easier for California parents to get a vaccine medical exemption for their child? Thank you for joining us. I'm Alex Bell, and that is the discussion happening right now at the Capitol. ABC 10's Becca Habecker joins us after attending a spirited committee hearing today.
Yeah, Alex, the California Senate Health Committee is considering a bill that could make it easier for children to qualify for medical vaccine exemptions at school. Right now, California does not allow personal belief exemptions, only medical ones. And since 2021, those medical exemptions have come with stricter oversight and additional requirements.
The one thing, Madam Chair, I would like to make very clear to you, the committee, and the public is that this is not an anti-vax bill. This bill does not call into question the efficacy of childhood immunizations.
Republican Senator Brian Jones presented his bill, SB 1377, to the Senate Health Committee Wednesday afternoon. Democratic state senators Ben Allen and Dave Cortese are co-authors.
The bill, we think, represents a narrow, targeted reform, maybe a beginning of a longer conversation. We'll see.
A longer conversation about how California regulates medical vaccine exemptions and whether that needs to change. A law passed in 2019 and which went into effect in 2021 overhauled and standardized the system by which medical exemptions are submitted and overseen. In part, the law flags doctors who submit 5 or more medical exemption forms in a calendar year. The California Department of Public Health then reviews the forms and can revoke any they find to be not medically necessary. A doctor with too many revoked forms can face discipline. Since 2021, 26 doctors have been disciplined. Those opposed to the current system say it makes it more difficult for kids who truly need a medical exemption to find a doctor willing to issue one, saying the state scrutiny creates a chilling effect.
They are being denied equal access to education.
Since 2021, more than 30,000 medical exemptions have been issued. About 2/3 were reviewed by the state, and roughly 15% of those were revoked. Around 100 of those were later overturned on appeal.
This system now has been working very well, and there's no reason to break the system.
Dr. Dean Blumberg is a childhood infectious disease specialist. He and others who support the current law say it provides important oversight and helps prevent doctors from issuing too many exemptions, adding that a high vaccination rate protects everybody from infectious diseases.
And that's why it's so important to continue this oversight to make sure that the medical exemption process is carefully looked at so that children who get the medical exemptions have them for true medical reasons, that these children are protected and the rest of California school children are protected.
He spoke in opposition to Jones's bill, which originally attempted several reforms, but last-minute amendments narrowed its scope.
There are kids in California today that have medical exemptions, and as they get older, they lose those exemptions as they go from elementary to junior high school.
Jones's bill was narrowed to simply allow that medical exemption to carry over between schools and not expire.
As of my walk to the studio just minutes ago, the senators are still debating various bills at their hearing. They plan on voting on Senator Jones' bill at the end of their meeting, and they have not come close to that quite yet. So we'll have the latest on air and online as soon as that decision comes in.